chronic pain in the shoulder is not normal in any age group. It doesn't matter how old you may be or how active or not active. Chronic pain in the shoulder is not a normal part of aging. When we talk about shoulder arthritis, most people have heard that term, but what does that really even mean? Well, again, the shoulder, in essence, is a ball and socket joint, the main joint of our shoulder. If you were to look at it on the inside, I use my hands as an analogy. If your arm came up like this and ended in a ball, that's what it looks like. And the socket looks like my other hand. It's relatively flat. It's not completely flat, but it's pretty shallow. Because of that, the shoulder is the most mobile joint in the body. In a normal shoulder joint, you have the bones, and in between, the bearing surfaces or the gliding surfaces are made of cartilage. Arthritis essentially is when those surfaces wear out or wear down or fragment. And so what you're left with, instead of a nice space and a smooth surface, you're left with the bones touching each other. Once the bones begin to touch each other, they then start to wear down the surfaces of the bone themselves. You develop bone spurs and irregularities, and you get the proverbial square peg in the round hole. So it's no longer running smoothly like a ball bearing would normally expect to move. And you get that classic combination of pain, loss of motion, catching, grinding sensation, and really a deep aching pain that's unlike other conditions. And so some people use the analogy of car tires. Arthritis is like your tires wearing down, but if they wear down enough, the tires completely come off and you're down to the rims. And I sometimes tell people that you can drive, it turns out you can drive your car on the rims like you see in the movies sometimes, but the car does not like it and it doesn't behave well. And if the car could complain of pain, it probably would. And so driving on the rims is not good. And trying to work your shoulder and function with bad shoulder arthritis is really debilitating, and unremitting chronic pain is not a good thing to live with for a number of reasons. Obviously, it hurts, but I sometimes explain to people that chronic pain has an impact on those around you as well. So you may think, well, I'm stoic and I can live with pain, but what you may not realize is it impacts the people around you. It impacts your mood and your ability to interact with your family and your friends and your coworkers, and it really has a bigger impact than most people realize. And so some of what we do while we're simply repairing damaged joints is really having a bigger impact on people's quality of life than they necessarily anticipate. So again, I think that when you're thinking about arthritis, there's no one-size-fits-all solution. There are many options that we have at different levels for treating it, and all those things have to be individualized and customized to an individual person's circumstance and what their goals are and what they want to achieve. So in terms of thinking about, is what's wrong with my shoulder arthritis? It's a common question that I get asked. People sometimes say, well, arthritis runs in my family, or I have other arthritic joints. I'm worried that maybe it's arthritis. Sometimes I'll express it to people by saying, well, not all pain is arthritis, first of all. But at the same time, chronic pain in the shoulder is not normal in any age group. It doesn't matter how old you may be or how active or not active. Chronic pain in the shoulder is not a normal part of aging. I'll sometimes hear that from people. They'll say, well, what can you expect? I'm getting older, so I must have pain in my shoulder. That is not true, and there are studies to back that up. In other words, most pain that people are having can be diagnosed and treated at some level. In an older person, it may very well be arthritis. And if that's the case, getting seen, getting it evaluated, and at least talking about what the treatment options are, at least gives that person, I think, some handle and hope for making things better. As often as not, the person assumes it's arthritis, but in reality, it's not. They thought it was arthritis all along. It turns out it's not. They were afraid that they needed some very major operation. Turns out they didn't. But again, without evaluating it, seeing the person, examining their shoulder, and getting some basic studies and images, it's just, you don't know. And so I think the unknown is what really is the worst for people. Finding out what's wrong gives you the power and the knowledge to then take the next step and decide what the next and right treatment program is. Arthritis in the shoulder is also very, very common. It's one of the most common large arthritic joints in the body, right after hip and knee. And shoulder replacements are something that we do quite a lot of. But before there's the talk of a shoulder replacement, there are many treatments that we can offer for people with arthritis that are much less invasive and have good outcomes as well. So while arthritis can certainly be at the extreme of bone-on-bone, really bad grinding in the joint and just unremitting pain. And then the end point is a replacement of the joint, much like a hip or a knee replacement. There are many people that are suffering with pain that's arthritic in nature. They're younger, they're still at a high level in terms of sports. They're not ready for a shoulder replacement, that's for sure, but there are many treatments that we can offer them as well. Particularly in the last few years, there have been some newer techniques, some of them involving injections with stem cell or PRP, some of them involving minimally invasive surgical approaches, arthroscopy to deal with some of the issues that are causing the pain in the shoulder, to help them preserve their shoulder function and treat their pain in the medium term until there comes a point where that's not going to work. And ultimately, there are patients who do need shoulder replacement. And shoulder replacement has also advanced quite a lot in the last 5 to 10 years. The materials are much different, often using 3D printing techniques and customization to fit patients much more accurately than we were able to in the past. We have more advanced rehab programs that recover people more quickly in terms of function and use of their arm. And there are conditions that we used to not have any treatment for at all, particularly something involving arthritis and torn tendons, which we're now using techniques such as reverse shoulder replacement as the state of the art to treat these conditions that were previously essentially untreatable. We had no solution for them. And now we have really quite good solutions that are really radically changing people's quality of life. So, when it comes to treating arthritis, it can be one of the most gratifying things that I do, because I'll often see someone who's really suffered, often for years, with really unremitting pain with most of what they do, including just trying to sleep at night. And you can really dramatically change their life by reducing or eliminating that pain. And really, there can be some of my happiest patients and most grateful patients, and that just is really gratifying for me.